Hello and welcome to Health Professional Radio. My name is Patrick Reyes, and on today's show we are joined by Charlene Grosse. She is an accredited practicing dietitian and spokesperson for the Dietitians Association of Australia. Welcome to the show, Charlene.
Thank you, Patrick.
All right, so can you tell us about yourself and what it is you do?
Sure. So I'm a dietitian, so an accredited practicing dietitian, and recently I achieved my advanced credentials. So I've worked as a dietitian since around 2001, and I've had a couple of different hats that I wear. So one of my roles is to manage a dietetics department in a large private hospital, and more recently that's turned into managing allied health, so the physios, the OTs, the speech pathologists, and the dietitians and social workers. But my other role that I've been looking at over the last sort of 8 to 9 years is being a dietitian that specialises in particular health diseases or health issues, and those areas are gastrointestinal diseases. So for people with irritable bowel syndrome or Crohn's disease, ulcerative colitis, celiac disease, etc. And for those patients that have weight loss surgery, so the sleeve gastrectomies, the bypass surgeries, and the laparoscopic bands.
And what inspired you to become a dietitian in the first place?
Coincidentally, it was a bit of a last-minute decision. Pretty much had to make a decision for university applications and closed my eyes and picked one of the top 3 that I had, and that was the one I selected. And I was just lucky that it was a course that I really engaged with. And, I think if I get down to the crux of it, if we're healthy in our digestive systems, it can just impact on your whole health. And we're just learning so much more as the research develops around how health is impacted by our digestive systems. And I just think there's so much potential that we can help people in our society to be the healthiest that they can be and help manage health or disease symptoms that they may be getting and improve their quality of life. And it's just such a wonderful area to be involved in.
Mm-hmm. And, actually, you've been recently awarded with the Dietitians Association of Australia Award of Merit. Can you tell us how you got the award and how you felt after receiving such award?
Oh, thank you. Yeah, so that particular award came about from some of my peers that had kindly nominated me. So that was in the area of the weight loss surgery, or what we call bariatric surgery. So I'd worked in practice with some surgeons for many years, and I also worked in the hospital, and I just identified that there was a gap in terms of what private practice dietitians were doing, what hospital dietitians were doing, and the difference between what they were doing between public hospitals and private hospitals. And, I think it's really important that we have standardised care for patients, that they're getting the same advice and the best advice from what we know from the research. So I worked with some other colleagues in the area to develop a interest group in WA where we got all the dietitians working together and invited them to form a working party. And the other part of what I did was to work on advocating with the DAA, the Dietitians Association of Australia, to actually have a bariatric interest group. So previously they had an obesity interest group, and I felt that the weight loss surgery was quite a different area of dietitian knowledge and therapy that we provide. So I worked on establishing the local level, and then I was able to put a business case together for the board and establish a interest group Australia-wide. So that actually became the fastest growing interest group and one of the largest memberships that they now have in Australia. And, with a great team of dietitians, they've been able to achieve some really good outcomes, and we're now in the process of developing a course to help dietitians in the area upskill and be able to increase their knowledge and expertise in that particular area. So the award was for the work in weight loss surgery and being able to advocate and lead dietitians in that area.
And you're also well known by specialists and GPs for your extensive knowledge and training in the low FODMAP diet. What is a low FODMAP diet?
Yeah, it's a good question. So a low FODMAP diet is a diet that is used predominantly for people that have irritable bowel syndrome. So FODMAP is an acronym. So it, in its simple term, is basically poorly absorbed sugars that we consume in our diet that come in a range of different foods. that can cause gut symptoms, whether that be bloating, diarrhea, constipation, wind, distension, pain, etc. So Monash University for many years have been the world leaders in the research around this particular diet, but it is quite a complex area. So it's been an area that I've specialised in Perth and tried to be a leader in that area to make sure that I'm up to date with the latest research. But it can be, for 3 out of 4 people with irritable bowel syndrome, it can be very effective at improving their quality of life through symptom management with the diet. But it is only meant to be a short-term diet, and what we do is work out the patient's individual intolerances to be able to manage their symptoms but have as much flexibility in their diet as possible.
I see. All right, and can you tell us a little bit more about specialized nutrition care?
Yeah, so Specialised Nutrition Care is a private practice of accredited practicing dietitians, and it's a practice that I've been very passionate about developing, and that came out of seeing a need that as private practice dietitians, often it's very much about needing to know a little bit of everything, and it's very difficult to keep up with all the research. And with my passion being in weight loss surgery, oncology and gastrointestinal diseases, I've been able to get some colleagues and establish a practice that allows us to specialise and be leaders in those areas. So we operate in Perth, in Subiaco, and have dietitians that specifically work in both the hospital setting and in the private practice setting, which I feel is very important in private practice, to have those hospital skills where, you're working with very sick patients at times and, keeping up to date with all the latest research. So, Specialised Nutrition Care has allowed us to bring our hospital experience into the community and to be able to give patients individualised advice, dietary advice, to help them on their journey to health, using a team of expert dietitians.
Mm-hmm. And where can people learn more about Specialised Nutrition Care?
Yeah, so we do have a website, so it's www.specialisednutritioncare.com.au, and we are able to offer Skype consultations as well. If someone's not in Perth or in the country, we can do Skype or phone call consults are also available as well. You can have a referral or you can just self-refer, but there's the information on the website there available, and they're welcome to contact us if they'd like any further details.
All right, again, that website is www.specialisednutritioncare.com.au. And before we end our segment, when it comes to nutrition care, what are some of the more common misconceptions that you've heard?
I think when you look at something like, say, the FODMAP diet, it's quite a popular terminology in households at the moment, and it's in over 100 countries. But I think that's often mistaken by people to mean that it's the healthiest diet to follow and that it's a weight loss diet, and it's not intended for that purpose. So it is really important that people with the actual diseases that have been researched, we get the expert guidance from an accredited practicing dietitian. I think more general things like around the avoidance of fruit at the moment, with the whole, quit sugar hype that's around, the misconception that we shouldn't be including fruit, whereas fruit is a good part of our healthy diets and should be included at the 2 serves a day. And I think that probably the biggest challenges that the community experience is that there's so much nutrition advice being provided by whether they're lawyers or they're celebrities or they're chefs, people that aren't trained and qualified. To be a dietitian, it's a 5-year master's degree around Australia. So, there's a lot of intense training that occurs. But I think sometimes, we're looking for that quick fix, and it's not always that simple. Sometimes it just comes down to moderation of foods in the diet to be healthy. But, obviously knowing that accredited practicing dietitians can provide that individualised expert advice.
Well, it's been a pleasure talking to you today, Charlene.
Thank you, Patrick, for the opportunity.
Thank you. You've been listening to Health Professional Radio. I'm your host, Patrick Reyes, and we've been in conversation with Charlene Grosse. She's the spokesperson for the Dietitians Association of Australia. If you missed our conversation or if you'd like to listen to this interview again, transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.